What are 12 things that patients don't like? Or let's phrase that differently. What are 12 things that you can change that will get patients to love your practice so much more and say yes to treatment, refer others, show up on time, do all of those great things that we like them to do? That's what we're going to be talking about on today's episode of the Dental Practice Fixers podcast. Hey there. This is Dr. Richard Maddow. I'm co-founder of the Maddow Center for Dental Practice Success. You can find me at Rich, R-I-C-H, at Maddow, M-A-D-O-W.com. And let's get down to it. 12 things, maybe we can even call them a dirty dozen things that patients don't like. Some of these you already know, but it doesn't mean that we can't improve. So, speaking of something you already know, but most dentists just don't seem to comply with, let's start with our first one on the list, and that is running late. Patients hate it when you run late. Even 5 minutes late can feel like forever sitting in the reception room or the dental chair. It just says to them, we don't care about your schedule. Our time is more important than yours. We can't run our schedule correctly. Now, those things may not be true, but that's what it says to the patient. And remember, perception equals reality. And I'm telling you, in my practice, once we decided we weren't going to run late anymore for years, I mean years, we just simply did not run late. We ran on time. Maybe one or two times a year, we would take a patient back late. And the first step was, and this is my little secret. It's no big secret. The first step is making a practice policy that says we do not run late. Sounds simple, but that's the really important first step. And that means a procedure goes bad, a patient is 30 minutes late for their 45-minute appointment. The doctor goes up to the front desk and says, "Oh, come on, I can do 2 crowns in 11 minutes. I know I can." The answer is no, we can't do that. You might have, and look, you might piss off a patient. I've been coming here for 5 years and you're telling me you can't see me because I'm running 30 minutes late. Well, you know what? I'd rather make that patient temporarily upset than run late for every other patient on the schedule the rest of the day. So it starts with the policy of we do not run late. As a matter of fact, is it more complex than this? Of course, but this is where it starts. In my new book that I've probably told you about, it's called Creating Your Ideal Dental Practice, How to Boost Your Income, Love What You Do, and Build a Winning Team. There's a whole chapter on never running late. There's so much more great stuff in that book, too. You can get it on Amazon. I made a shortcut for you. You can go search on Amazon, or I made a shortcut. It's maddow.com/book. MADOW.com/BOOK. You can go to that link. It'll take you to Amazon. You can go to Amazon, or if you want a signed copy from me, personalized if you like, you can just go to maddow.com/signed. MADOW.com/SIGNED. Okay. Number two thing the patients don't like, and that is when you make them feel like they are, I'll use air quotes here, the crown prep in room 3. It's a metaphor, but I cannot tell you how many times I've been in a dental practice and I hear them say something like, we've got a crown prep in room 3. We've got a scaling and root planing and hygiene room 2. Well, if that's the way you're saying it, that's how you're going to make the patients feel. They are whole people. They're not teeth or procedures on legs. We need to get to know them, converse with them about their personal lives and things that are fun and important to them. If we treat them like the crown prep in room 3, next, it's going to show, and they will not love your practice. Okay, number 3, things to pay. And I hear this all the time. People say, "Oh, well, we educate our patients. We educate our patients," and nothing wrong with that in principle. Nothing wrong with that in principle, but 99% of the time when I hear a dentist or hygienist or dental assistant or whatever try to educate their patients, they are using lingo the patients don't understand. They're talking way above their heads. They're giving way too much detail. I always say, when a plumber comes to my house, I don't want them to educate me. I want them to fix my damn sink. And it's the same thing with our dental patients. Sometimes we spend way too much time talking about the minutia and intricate details, and we do it in lingo they don't even understand. We're not trying to turn them into dentists. We're trying to make them the best patients possible. So let's not take this education thing too far. We want our patients to be excited about their treatment, which means we need to be enthusiastic about it. Big difference between enthusiasm and education. And I got to tell you, I'll take enthusiasm every single time. Okay, number four thing that patients hate, and that is what I'll call financial confusion. How much do you owe? What's covered? What's not covered? How do you pay it? How does the financial arrangement work? I think the number one source of no-shows and last-minute cancellations, other than new patients, they're the number one source, potential new patients. Other than that, it's when a patient doesn't understand their financial arrangements, or even when they do understand them and they owe money. I never have patients owe money. And that is even the old pay half of the prep, half of the insert. That's a patient owing money. In my practice, paid in full on the day of the procedure. If you have to give a discount or come, use third-party financing, of course, come up with some kind of scheme. I don't care how you do it, but a patient who owes you money is a patient who's not happy. So let's get that out of the equation. No financial confusion. Treatment must be paid for. There's nowhere else in the world you can get goods or services without paying for them. Why make your dental practice that one place? Okay, number five thing that patients don't like, and that is not knowing what's next. I think if you maybe even discuss this at your morning huddle and take stock of it, so many times a patient will leave the treatment room and just be a little bit unclear on what the next step is. And I always love to, yes, it takes an extra couple minutes, but reiterate this with the patient. As you know, we're scheduling next time for this, whatever, for a core and crown. And just to make sure you understand, the reason we're doing that is because this tooth is so broken down, it couldn't hold an old filling, and you're really risking losing it or getting a root canal. So we're going to remove the old filling, take out any decayed portion, build it up with a strong material. You see where I'm going here. Make sure they know why they're coming in, what you're going to do in easy to understand terms at the next visit. And then sometimes I love to throw in a little consequence. It's really important because if we don't get this done, the tooth could fracture or break, and you may wind up losing it or needing a root canal. So make sure they know why they're coming in simple terms, what you're going to do, and what the consequences are of not having it done. Patients don't like not knowing what's coming next. They love to be informed. And that goes for the old handoff. I can't stand it when I see a patient wandering the hall. I don't care if a patient needs to go to the bathroom or if they're done in the treatment area and needs to go up to the front. They should always be escorted by. Now, I'm not saying you should go into the bathroom with them. That's probably crossing many, many lines. Never let a patient roam your hallways unescorted. Always, I call it hold them by the hand, not literally, but make sure they know exactly where they're going and why every step of the way. I've been cut loose in like physician's offices. Oh yeah, just go in this door and turn left. You can't miss it. I feel like I'm roaming around in circles. Not a good look. Don't let that happen to your patients. Okay. Number six thing that patients don't like is the good old rough prophy. Hygienist out there. Yes, be thorough, but be gentle. Patients don't want to think that you're going to be asking for their Red Cross blood donation card after they finish with the visit. Being cleaned up should not feel like a punishment. And many times this is caused, wow, we're really going off on a tangent here, but it's an important one, is because we're just not properly diagnosing and presenting periodontal therapy. And we wind up doing bloody prophies, i.e., perio treatment, but billing for a prophy. We get way too rough. No, 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 no. It's not good for anybody. It's not good for the practice. It's not good for the patient. It's not good for the hygiene team. If we really need to go deep and a patient has some perio issues and we're going to do scaling and root cleaning, let's get them in for exactly that and numb them up if they need to be numb. If we're doing a regular prophy, we should be able to do it gently and with the least amount of trauma possible. Speaking of the least amount of trauma possible, I want your overhead to be low. Dental overhead is traumatic. You know, at the Matto Center, we use stacks for our credit card processing because they don't charge us that nasty percentage overage. We just pay a flat monthly fee for our processing. You could do the same. So many dental practices are doing it and saving thousands and tens of thousands every year. Go to matto.com/save to learn more. I highly recommend that you use Stacks. We use them at the Matto Center. You should use them too. Okay, number 7, we've been talking about painful prophies. Painful injections. I think if they even know you're giving an injection, it's a fail. I think this is one area where it's so worth it to spend the extra time. Use the topical. Make sure that topical has time to set in. Then give the slowest, easiest, least amount of pressure injection you possibly can. Make sure you trickle in some anesthetic to numb the area internally before you go in any deeper. You know, anyone listening to this who's a doctor or hygienist who's licensed to do this can give a painless injection. The skill level's not that high. It's wanting to do it. It's being patient. I like to think I'm on the other end of that needle when I'm giving an injection. Painful injections, to any extent, not acceptable. Take a deep breath, take some time, be pain free. And then the corollary to that is number 8 thing that patients hate, and that is having to feel anything during a procedure. You can call it like numb, but not numb. If that anesthesia is not 100% drop dead, complete, and profound, don't even rev up that handpiece. I never, ever, ever want a patient say to me, "Hey, I can feel that a little bit, doc." Now, I know some patients, they can feel it even before the handpiece touches the tooth. That's a different situation altogether. But let's make sure our patients are profoundly, completely numb before we do anything. And I mean anything. Okay, number 9 thing the patients don't like, and that's if they feel like you're rushed, they feel like you're distracted, they feel like you've got one foot out the door, like you're thinking of something else when you're talking to them. Unacceptable. They feel like you don't care. If you have 45 seconds to spend with a patient, that's not enough time. But let's just say for some reason you're spending 45 seconds with a patient. That 45 seconds is theirs. Clear your mind of everything else. That is their special time with you, whether it's 45 seconds or 45 minutes. When you're in the room with a patient, you need to be 100% present, focused on just them and their needs and their comfort at all times, or else they will feel like you don't care and you'll be violating rule number 9 of the 12 things the patients don't like. Okay, number 10. Man, I've seen this so many times. Patients do not like a wishy-washy dentist. They want you to be so definitive. Now, I know in dental school and in courses we learn give options. But could you imagine, let's say that you had a growth on your arm and you went to a dermatologist, and the dermatologist said, well, we could just rip the whole thing out by the roots. We could do a biopsy. We could watch it. It's like, I don't want to hear we could. I want to know what's the best thing. What's the best thing for me? That's why I don't like it when it does. Well, we could do this, and we could do a partial denture, we could do an implant, we could. I say start with the treatment that's the best, the treatment that you would want on you, on a family member, and offer it to the patient confidently. They can tell when you're confident and when you're wishy-washy. I love looking them right in the eye and saying, I know what the problem is, and this is how we can fix it. And then tell them how you're going to fix it. Well, we could do this, we could do this, we could watch it, we could wait, we could watch and wait, we could wait and watch. Come on, be definitive, be confident. Don't be wishy-washy. Patients do not like wishy-washy. Okay, number 11. This one's going to sound kind of silly, but it's really important. Something patients don't like. Patients don't like going to the dentist. We can never forget that. They come in with fear, sometimes with shame, fear of pain. They come in pain. Going to the dentist, your office is not their happy place. And that's something we have to deal with every second of every day. We have to realize no matter how much they joke around or they seem jovial, for the most part, patients don't want to be there. And also that leads to another thing. We tend to judge people subconsciously, fully consciously. Let's always remember that many times we're seeing people at their worst, or certainly not at their best. If you ran into this person in a social situation, or maybe it's something they love doing, fishing, or at the ball game, or at a concert, they'd be a totally different person. So let's realize that we are seeing people who aren't at their best. Give them a break. The crankiest patients need the most loving. So let's make sure or the most Mick loving. So let's make sure that we do this. That's 11 things that patients don't like. I'm going to tell you number 12 in a second, but I want to remind you that if you're a podcast listener or watcher and you're not on my email list, it's time because I give tips like this almost every day and I turn you on to some new products and services, some seminar appearances, great tips. People use my e-letters at their morning huddles and team meetings. Just go to matto.com/newsletter to sign up. It's free, of course. Unsubscribe anytime you like. I don't care. Just give it a try. Matto.com/newsletter. Okay, number 12, things that patients don't like. 2 words. Hold, please. Ugh. If your phones are sounding like the DMV on a bad day, it's time for a change. You should never, ever answer the phone and put a patient on hold immediately. It's horrible. It's rude. It's a bad way to start the conversation. Don't do it. But always pick up the phone every single time it rings. That's primary. If you find that you pick up the phone every single time it rings and you're doing a lot of hold, please, might be time to train the entire team and how to answer the phone properly and make sure everybody knows that never let a phone ring. If you can get it, grab it. Sure, the front desk team takes primary responsibility, but if you can get it, grab it if they can't. That's 12 things that our patients don't like. I just want to review a few links that I gave you. Get my brand new book, Creating Your Ideal Dental Practice, How to Boost Your Income, Love What You Do, and Build a Winning Team. You can go to matto.com/book. You can look for it on Amazon, or you can go to matto.com/signed to get a signed copy. Sign up for our newsletter. You'll get some great tips a few times a week. Use them in your huddles, your meetings. You'll be informed of all kinds of cool things. Matto.com/newsletter. And don't forget, save tens of thousands of dollars on your credit card processing with a low flat monthly fee. Go to Low flat monthly fee. That sounds weird. Low flat monthly fee. Go to matto.com/save to learn more about that. Hey, I hope you enjoyed this Dirty Dozen. Send me an email. Let me know what you think. You can reach me at Rich, at matto.com. I'm Dr. Richard Matto. I really, really, really appreciate you spending your time with me, and I'll see you soon. Bye.